Our next speaker is Dr. Scott Berman. Scott is an adult and geriatric psychiatrist. He trained at Hahnemann Hospital and has worked with uninsured, underinsured, and homeless patients throughout his career. He and his family have also had some personal first-hand experiences with the difficulty of getting insurance before these changes and some other personal things he can talk about. So, thank you, Scott.
Good morning, thanks for coming out. I want to talk to you both as a doctor and a patient. As a doctor, when I started in 1989, working in a small community hospital that again took care of a lot of folks with no insurance, we saw its horror story after horror story. People lose their insurance into the old plan. The only thing they can do is get COBRA, which is the 18-month extension, and that comes out of pocket. So, and lots of patients who wanted to quit psychiatric treatment just at the moment when they needed it because they were most stressed from losing their job. Also seen horror stories like a couple, both of whom were diabetics, and they were on the same medicine, but because of the choice between buying food and buying medicine, they would take their sugar pill every other day. She took it Monday, he took it Tuesday, she took it Wednesday, he took it Thursday, and they had to eat less on the days they couldn't take their pills. We've seen a lot of bad stuff over the years. Working at Hahnemann, Center City, Philadelphia, you see what happens to uninsured people, and I used to tell them the system we're sending you out into will always be crazier than you are, even as a psychiatrist. And it's always been true. The system's been broken for a long time, and it's high time that we had some reform. Obamacare doesn't solve all these problems, but it's a great start. It's a start towards accountability. Accountability for insurance companies, which now have some regulations and can't do whatever they want with you. Accountability for hospitals, which now get penalized for bad outcomes rather than paid for doing more procedures. Accountability for doctors. By the middle of this year, you can go online and see how much drug company money or gifts your doctor got from anything more than a $10 pizza goes online at the Center for Medicare and Medicaid Studies. It's also a period of accountability for patients. Because not being insured is no longer taking a stand against the government or unpopular policy. It's taking a stand against your fellow citizens. And I've always worked for nonprofit hospitals. I've never worked for a for-profit hospital as a matter of principle. Nonprofit hospitals like Sacred Heart are not going to throw people to the curb who don't have insurance. But if you don't have insurance, you'll have to take donor money from the community and taxpayer money to pay what you didn't pay in by buying insurance. So not only is the Affordable Care Act a nice entitlement program, and I mean that in a positive way, it's also a responsibility, because if you can get insurance, there's two possibilities. God willing, you stay healthy, and the preventive health care measures will help you stay healthy, and it all works out well. If you're not healthy, I can tell you from looking at lots and lots of medical bills, 24 hours in any hospital in Lehigh Valley will cost more than a platinum plan for a year. Okay. My son's lymph node biopsy at a different hospital, a 3-hour outpatient procedure was $21,000. We paid the insurance paid $5,400, and we paid $600 because we had insurance. What does that say? If you're uninsured, you'd have to pay the $20,000. So prior to Obamacare, if you couldn't get insurance, the poorest people or the sickest people would have to pay full price, and people who were healthy or could afford insurance didn't pay full price. Which doesn't make any sense in terms of access to care. Let me tell you a personal story about my own experience with the Affordable Care Act. In 2009, I lost my wife to cancer. Prior to her death, we were paying $1,000 a month for my wife and 3 kids. Because of my disability, I have Medicare, which is great, but it doesn't have any family benefit. When she died, the insurance company could legally increase the insurance for my 3 healthy kids to $1,500 a month, which, having just lost my spouse and half of our income, I couldn't afford, but I had to pay it. I'm not going to leave 3 little kids uninsured. We did this for a year or two. Then I was able to get 2 of my kids onto a less good plan, but the plan said, well, your kids had grief counseling, that's mental health, therefore they can never have mental health benefits. So when the Affordable Care Act first came, this is the beginning of another stage of the Affordable Care Act this year. When it first came into being, was it 2010, 11? So in 2010, they could no longer discriminate against pre-existing. So I took my son who had the pre-existing condition, went to an insurance company and said, I want the guaranteed issue. What's guaranteed issue? They can no longer turn him down in Obamacare Phase 1. They could, however, charge me $520 a month for one kid. Okay. So then I was paying for 2 kids in one plan and $520 a month for another kid. Again, unsustainable financially in even the short term. When the exchanges came out this year, what was I able to do? I took my son who had the $520 a month plan that was guaranteed, they couldn't ask about his health, went to the same insurance company, got the same coverage for $105 a month, because now they can no longer increase your cost to the pre-existing. My oldest daughter's out on her own, she has employer insurance, so she doesn't have to do anything. My middle son now has the same plan as he had with the same company, except, I guess grudgingly, now they have to give him full benefits, mental health, physical, everything. So at the end of the day, all my kids are covered at a price we can afford, covering everything. For us, this is a great thing. You know, health insurance isn't free, and certainly paying for it can be a burden, but I think it's a burden we have to assume. I know it's going to be confusing for people to start buying it outside of their employers. You have to learn what a copay is, co-insurance, maximum out of pocket, deductibles, but it's worth getting lots of information, and we have a list of local resources for you. Hope you get good information, make good choices, and take advantage of this plan. Thanks very much for letting me speak this morning.